Perineal flushing.
Hi, good morning. My name is Kaimer from BSN 12F, and today I will be performing perineal flushing. So perineal flushing is a hygienic care that involves cleaning the perineum and the genitalia. So first of all, we have to prepare all the needed materials and wash our hands. This will save time and energy and also deter the spread of microorganisms. So these are the materials needed. And also then, since I am done to wash my hand, I am going to explain the treatment to the patient. So this will let the patient understand the procedure and gain patient cooperation. So hi, good morning ma'am. My name is Kaime, your student nurse for today. And today ma'am, I will be performing perineal flushing on you so that I can be able to cleanse your genitals and you will be able to feel comfortable. Is that alright? Okay, thank you. And now is we are going to screen the patient or locks the door of patient's room. This will provide patient privacy. So next is we are going to position the patient on a dorsal recumbent and also put the patient on bedpan. So this will, for patient, this will make the patient comfort and prevents the bed from becoming soiled. So before that, I am going to wear my working gloves. So now, ma'am, I ask you if you could flex your knees and open your and separate it apart, so I can be able to see your genitals clearly. So now, ma'am, can you lift your hips and I will be going to assist you in lifting your hips. So in a count of 3, 1, 2, 3. 3. Right. So next is we are going to drape the patient, exposing only the parts to be cleansed. So minimal exposure lessens the embarrassment and helps to provide warmth. So now, ma'am, I'm going to drape you and only exposing your genitals. And then now is we are going to flush the perineal area with warm water. So warm water is used to prevent chilling and soften or dissolve blood clots. So now, ma'am, I will be flushing your genital with a warm water. Now, get a cotton ball soaked in cleansing solution using pickup forceps to maintain sterility. One, two. So using our working forceps, we are going to use this to cleanse the the genitals of the patient. So first is we are going to cleanse the internal genitalia starting from the midline of symphysis pubis down to the anus. So we should never trace a stroke. This will prevent contamination of the area. So starting from the symphysis pubis to the anus, and then discard. And the next is we are going to use the second cotton ball to cleanse starting from mons pubis in figure 7 by way of external labium towards the anus, and then after that we are going to discard. So secretion that tend to collect around labia majora facilitate bacterial growth. So from the mons pubis to the labia majora, and then discard. And the next is we are going to do likewise on the opposite side with the next cotton ball. So, mons pubis to the labia majora, and then discard. And the next is we are going, with the fourth cotton ball, we are going to start cleaning from mons pubis in a figure of 7 by way of the internal labium towards the anus. Then we are going to discard it. This is also to prevent bacterial growth. So, mons pubis to the anus, I mean, labia minora. And then we have to do likewise on the other side. So, mons pubis to the labia minora. And then next with the other cotton ball, we are going to clean the groin, starting from groin going up the thigh. So we are going to use other side of the same cotton ball for near groin. So this will also prevent bacterial growth. So discard, and the next is the other one, and then from the groin up to the thigh. So next is we are going to flush the perineum thoroughly with sterile water. This will wash off the discharged perineal area. So now ma'am, I'm going to flush your genital with sterile water. So now using our dry cotton ball, we are going to dry the perineum with the same stroke as earlier that we did. So moisture support the growth of many microorganisms. That's why we are going to dry it up. So using our pickup forceps, we are going to put it in the basin. And then use our working forceps to dry up the perineum. So first is from the symphysis pubis to the anus, and then discard. Next is to the mons pubis to the external labium, and then discard. And then to the other side, mons pubis to the external labium, discard. And the next is mons pubis to the internal labium. And then the other side, and then from groin up to the thigh. And to the other side. So we are going to remove the bedpan gently and turn the patient to the side. So now ma'am, can you please lift up your hip in a count of 1, 2, 3 and lift. Okay. Thank you. And then we are going to let the patient face to the other side. So ma'am, can you face to your left side? Okay. So using our pickup forceps, we are going to put the cotton ball into the basin and use our working forceps to clean the buttocks of the patient. So we are going to also use the zigzag motion, and then discard, and then to the other side of the buttocks, and then discard. Okay. Now you can face front now, ma'am. Thank you. So, since we are done turning the patient on her back and making her comfortable, we can also spray with antiseptic if it is needed. So this spraying antiseptic will promote healing if the patient needs to perform internal examinations. So next is we are going to put the perineal pad with the width and up in up-down motion as needed. This will prevent contamination of the vagina and urethra from anal area. So we are going to discard this vagina picture and drape the patient. So we are going to put the perineal pad in an up-down motion. And then let her wear a underwear. So after doing that, we are going to do aftercare of the materials used. This is to prevent cross-contamination. So we are going to discard our working gloves now. And the next is we are going to record the treatment done to the patient and discharge observed. For documentation purposes, that procedure was done and means of communication to the other healthcare professionals. So for documentation, we are going to note for any redness, swelling, localized tenderness in the area, and also note for the secretion observed during perineal flushing. This will enhance communication on the other healthcare professionals. So now that we're done, we are going to go out of the room. And that's all. Thank you.